Hi everyone, welcome. Thanks for joining us today for our coffee chat. My name is Daniel Chuckenbrough and I'm a marketing assistant for our early childhood products at Brooks Publishing. And I'm very happy to have Marisa Macy joining us today to talk about child find and identifying children for IDEA services in remote and virtual contexts. So before we start, I'd like to just give you a few tips for watching today's webinar. And if you could just go to the next slide, Marisa. So to save bandwidth, if you're having any issues with internet access today, if you can close any applications on your computer that use internet, such as email or other web browsers. And if you have any questions during today's webinar, you can enter those on the questions section of your webinar panel, about halfway down. And if you'd like to minimize the panel so you can see more of the presentation, you can click the orange arrow at the top of the webinar panel as well. And if you're experiencing any audio issues during this webinar, you can go to the audio section of your webinar panel and there will be instructions for dialing in using your phone, and that usually alleviates any audio issues that you may be having. And I'd also like to note that there are the webinar slides available for download in the handout section of your webinar panel, but we'll also send you a link to those as well in the follow-up email that you'll receive. And in that follow-up email as well, there will also be a certificate for your attendance today. And so with that, I'll turn it over to Marisa and we can start our presentation.
Thank you, Dan. And also thank you to Amy Perkins and Brooks Publishing for inviting me to come and do this talk today. And I think maybe another webinar tip, number 5, the most important one, is that you have a cup of coffee or tea or something yummy to drink. This is a new cup that I just got from my daughter because on Sunday is Mother's Day. So hopefully you have something yummy to drink and sit back, relax, and let's have a conversation. So what I want to do is I first want to start by talking about Child Find. What is it? What the rationale for it is. And then I want to talk about some virtual and remote strategies for doing Child Find. And then how to take the information and communicate the results of Child Find with families. And then I'll talk about some additional resources. So I want to start by talking about 2 children, Adriana and Kendra. And this is a little vignette that is in the book that I'll talk about later, about connecting children with services. And the little girl, Adriana, both girls are 2 years old when they meet each other. They both live in a suburban area. They are both 2. They both have 2 older brothers, but one of them, and they both have communication delays. But Adriana and her family are able to access Child Find. In her community, they have a resource at the library once a month where families can take their children, do developmental screening activities, and be able to get information about how their child is developing. Adriana also had access to services right away when they found out she had a communication delay. She started to receive coordinated services and all of the necessary resources she needed to address her communication delay. Kendra, who also had a communication delay at age 2, she did not get Child Find services. She did not have access to community programs to ameliorate her communication delay. She didn't have coordinated services or any necessary resources. When they both got to kindergarten, Adriana soon exited special services and was able to catch up to the developmental expectations for communication at the kindergarten level, but Kendra just continued to get worse and worse in the area of communication. And not only did she continue to suffer in that area, but she also had 2 other developmental delays that she also qualified for services at kindergarten. Kendra did receive special education by the end of the kindergarten year, and then once she got to 1st grade, 2nd grade, she continued to need special education services. So the whole point of this talk today is the importance of timely early intervention services, that if we can get in there early and be able to detect delays and struggles that kids have early on, that once they get the early intervention services, it can make a huge, profound impact on their developmental, health, and behavioral outcomes. So that's kind of the foundation for what we're going to be talking about today. So Child Find, you can find it in the Individuals with Disabilities Education Act. It's part of our law, IDEA. And where does this law come from? Well, it was first passed by Congress in 1975. It was called the Education for All Handicapped Children's Act when it was first passed back then in 1975, and today we call it IDEA, or the Individuals with Disabilities Education Act. It was landmark legislation. It just was earth-shattering, and we are so lucky to have it here in America, the Individuals with Disabilities Education Act. We have it in all 50 states and outlying territories, and it has this Child Find component in it. And when it was first passed in 1975, it did not include babies. We didn't get that until later in an amendment of IDEA. But now today we have infants, toddlers, and preschoolers in the IDEA law, and Child Find is for not just infants, toddlers, and preschoolers, but it's for the whole age span, birth to 21, for children with disabilities. So what is Child Find, and what would it look like in the context of early childhood? It's a comprehensive system. It's consistent with the school age part here in early childhood for infants, toddlers, and preschoolers. And it ensures rigorous standards for identifying infants and toddlers with disabilities, as well as preschoolers. And the intention is to reduce the need for future services. So the idea, if we get in early, we start addressing children's needs that they might not continue to have needs later on. Or maybe they do, but the earlier the better. So how many children are we talking about in early childhood that we could or should be serving? For infants and toddlers, it's about 2 to 3%. For preschoolers, it's about 5 to 7%. And for school-age children, it's at least 10% or more. So for infants and toddlers, IDEA Part C is what we call the early intervention part. It's only about 2 to 3% of the population that we serve under Part C of IDEA. And so this is a bar graph that I made from data that I got from ideadata.org for Part C, infants and toddlers. And as you can see from this bar graph, over time we're identifying more children. So the latest data was from 2017, and we're increasing our population of children that we serve under IDEA Part C. And you can see the birth to 1-year-olds is the smallest group of children. Then the 1 to 2-year-olds is next. And then the biggest group for Part C is the 2 to 3-year-olds. So that's an example of the trends we see with Part C. With Part B, Section 619, that's the early childhood special education part of the law, IDEA. And we're picking up more children by the time they get to preschool. So it's about 5 to 6% of the population. And you'll notice a similar trend with preschoolers as compared to infants and toddlers. Over time, we're increasing the population that we serve under Part B, Section 619. IDEA Part B is the school age part of the law, but if you hear people say something about Section 619, they're talking about the preschoolers, children ages 3, 4, and 5. So we need Child Find, and these are just some of the reasons why we need it. We have substantial numbers of children who have developmental delays. Many more children are faced with multiple risk factors in their lives than ever before. Many developmental delays remain undiagnosed in young children. So the example that I gave with Kendra, the little scenario at the beginning, she was not identified early and went undiagnosed until kindergarten. So we want to be able to identify children early on. And then the other need for Child Find is the lag time from when we identify a child has a delay or disability or a concern, and then their entry into a program, we've lost a lot of time. So we want to be able to be responsive to our children's needs. So I'm going to talk about 3 sectors and some of the challenges that we face under these sectors. And the first one is education. And for education, the existing Child Find programs vary enormously across communities and states. The example that I gave with Adriana, in that scenario, they do Child Find once a month at the local library. And if that program in that community was compared to another one, maybe they do it once a year at the local library, or maybe they have a different kind of event where they call that their Child Find activity. So there's lots of diversity in how programs implement Child Find and what it looks like. There's also unevenness of accessibility to early detection Child Find programs across ethnic and income groups. So ethnicity and socioeconomic status plays a factor. And then another problem is the fragmented referral system. So a child might be screened and then might go on to get a comprehensive assessment. And then they might qualify for services, but somewhere along the line in that referral system at the different stages, there might be some barriers or breakdown of the system, and the family might not be able to access what they need in the educational setting. The other sector that I want to talk about is health. And Child Find is found in education, like I just talked about, health, and then also social. And in the health setting, the American Academy of Pediatrics recommends that all children receive early identification services, including surveillance and screening, and if needed, follow-up developmental or medical diagnostic evaluation. So that's a recommendation, and even despite this recommendation, many pediatric or other healthcare practices do not routinely screen their young patients. And again, it's just a recommendation. It's not a requirement like we have in IDEA, where it's a mandatory part of our law. And then another challenge is children may lack follow-up services in a healthcare setting as well. So if a child does if there is a concern with a child, the follow-up services may be lacking as well in a healthcare setting. And then the last sector I want to talk about is a social setting, social service setting. Many social service agencies offer only limited Child Find services for young children with whom they come in contact because of poverty, violence, neglect, abuse, or homelessness. So education, health, and social service settings all have Child Find. However, there's still challenges that we need to overcome in all of these settings. So I put together this picture of all of these different sectors, and my dream is that they would all come together and be a seamless system of Child Find. But right now in 2020, it's still fragmented. Early childhood education does their thing, early intervention and early childhood special education does their thing, social service providers do their thing, pediatricians do their thing, and we need to do a better job coming together and having a cohesive, streamlined system. And so these two things can be an impetus for Child Find. So we have the recommendations from the American Academy of Pediatrics that we need and must do periodic screening for all children. And then we have our federal law in education, the Individuals with Disabilities Education Act, which mandates that we have and conduct periodic and appropriate early detection Child Find activities for infants, toddlers, and preschoolers. So our law says we need to have 4 things in order to be able to have a good Child Find system. We need to establish a lead agency. We need to ensure widespread dissemination. We need to create a central directory, and we need to evaluate our state's child find efforts. So I'm going to talk about each of those 4 pieces of the pie. So the first piece of the pie is establishing a lead agency. So under Part B of IDEA, that's for children ages 3 to 21, the lead agency is always going to be the school district. So that's a no-brainer, no matter if you live in Illinois or Florida or New Mexico or Texas, it's the lead agency are going to be our school districts. But under Part C of IDEA, the lead agency is unique to each state. Each state decides who the lead agency is going to be. Here in Florida, where I live, the lead agency is the Department of Health. In Oregon, it's Department of Education, which there it's the same as Part B. Part C and B are the same. But the majority of the states, Part C is its unique lead agency. And so we would need to figure out what that is for each state. Child find services are provided at no cost to the parents and family of the child under the IDEA principle of free and appropriate public education. This is a really important organizing principle under the law. Parents should not and do not pay for child find services. This is part of their free and appropriate public education that they are entitled to. Anyone can refer a child to child find. So it could be a parent who notices their child is developing differently. It could be a familiar caregiver. It could be someone that the child spends time with who's got a concern. Could be a nurse or a healthcare provider, but it doesn't always have to be the parent. Okay, so another part of the child find system is that there needs to be widespread dissemination. So states need to have public service awareness about child find services. So in the example I gave of one of the children who receives the local library has the monthly child find service of screening. In that community, once a month, it's published in lots of different social media outlets. It's in the newspaper. They get the word out that these services are available. So whatever it is, it needs to be helpful to parents, and parents need to know about it, and it needs to be disseminated widely. And then there needs to be an effective community outreach initiative so that parents and families are able to access the services, that they know about it, and they know where to go if they have a concern about their child's development. The other thing that we need to have in our child find system is a central directory. So each state system is required to have a central directory of information that addresses child find and referral services. The central directory needs to include agencies and services in the state that provide IDEA screening and assessment, as well as related services. Could be speech, occupational therapy, physical therapy, behavior intervention specialists, but those need to be part of the central directory as well. Mental health is another one. And then we need to be able to have an evaluation of the child find efforts in our states. IDEA requires this, that state educational agencies evaluate their child find efforts. But one of the problems with that is that many states just report numbers of children screened through state initiatives and the numbers of children found eligible for services. So more information is needed about child find efforts. Child find data from states are reported yearly to the federal government through the state performance plan and annual performance report. So it's public information. States with lower than expected numbers of children enrolled in special education services are required to create a state plan that explains how these numbers will be increased by detailing their future expanded child find efforts. So that's all spelled out in IDEA, the law. So how do we find children? How do we locate the children who could be eligible for IDEA services? One way is through developmental behavioral screening. And so what that is a brief, easy to complete formal test of young children's developmental behavioral skills that reliably discriminate those children who should be referred for further, more comprehensive assessment from those who should not be referred. So that's kind of a working definition of what a developmental behavioral screening is. And there's a lot of different screening tools on the market. And I won't be talking about any specific tools, but I'll give you some further readings later on about places to go to find some. So recommendations for Child Find. These are some things we know can make a huge difference for identifying the eligible children in our states and outlying territories. Services need to be coordinated. We need to work across sectors with each other. We need to be able to come together and coordinate our efforts and locate the children who could benefit from IDEA services. Services need to be accessible, and we need to be able to have necessary resources available for children and families and service providers. And today I'm going to be talking about 4 different ways we can do Child Find in as an alternative to face-to-face early detection activities. So right now, a lot of us are home or being quarantined because of the global pandemic due to the coronavirus. And so a lot of places are needing to find virtual, remote, online opportunities to do Child Find. And a lot of states continue to need to be able to make referrals for children and families. And these are just some strategies that we can consider as we move toward being able to continue our work, because we're still open for business and we need to continue our Child Find efforts, even though we may not be able to do them face-to-face like we used to in the past. So these are just some ideas, and they can be continued even after the quarantine is over. So a lot of places that are remote and maybe rural settings may be already doing this even before the pandemic happened. So I'm going to be talking about 4 strategies. One is developmental screening over the phone. Another one is developmental screening online. I'm going to be talking about developmental screening on a virtual home visit, and then developmental screening via snail mail. So the first one is over the phone. So what that might look like is a service provider has a developmental screening instrument. They would arrange to have a time to talk with the parent over the phone. The parent and the provider would go through the different items on the screening, and the provider or the professional who's doing the phone interview would be scoring it over the phone. So there's a lot of different ways it can be done over the phone. One nice way is if the staff member could mail the questionnaire or the paperwork to the parent ahead of time, so the parent has it in front of them if they would like to have that. The staff makes a follow-up telephone call, and the parent and staff work together. Some considerations: be sure to have time and resources to talk on the phone. Be sure that the time is optimal for parents. We don't want to be able to do this in the middle of mealtime when they need to be doing other things with their family and their child. So timing is really important, that we find the best time for the family and the parent, who's, or not just parent, but it could be a familiar caregiver or somebody else who's going to be doing the phone interview with us. And that's over the phone. Developmental screening online. This is available through a lot of the publishers. The screening tools might be accessible through a website online, and the parent can go to that website and complete the developmental screening online. In order to be successful with that, some considerations: be sure the family has the technology needed for the online developmental screening activities. I know some families do not have access to reliable Wi-Fi. I was reading in my local paper just recently that one of the parents has 4 kids, and everybody gets in the car during distance learning and they go to the nearest restaurant or coffee shop where they have access to Wi-Fi in the parking lot, and everybody gets out their devices and does their homework in the parking lot in the car because at home they don't have Wi-Fi. So for online to be successful, we want to make sure that the parents have the technology that they need. And then another thing with developmental screening, it's important to know if the parents tried the items with their children. So we don't want them to just rely on memory. So once the kids go to bed at night and it's 11:30 at night, they go online and fill out the survey, but they can't quite remember if the child can do the skill or not. That might not be as good as if they're able to try the item or give the child an opportunity to show how they can perform the task that the screening might be looking at. Another thing we could do is a virtual home visit. So we can do developmental screening on a virtual home visit. So a lot of providers have home visits that are face-to-face, and doing a virtual home visit could be another alternative for doing child find. So it could look a lot like it does with the phone call, but with a virtual home visit, we might have access to a video conferencing tool like Zoom or Skype or FaceTime, and the provider, the staff member, is able to communicate and interact with the family directly, and maybe even be able to see the child performing and doing authentic activities that they would normally be doing. So maybe the home visit is going to be occurring during a typical routine for the child or while the child's playing, and so it could be an opportunity to do the screening through virtual home visit. Some considerations: be sure families have the technology needed to conduct a virtual home visit. I did a study with some colleagues of mine a couple of years ago, and what we wanted to know was which type of assessment parents would prefer, home or clinical-based assessments, and it was a survey of parents. And I assumed most parents would want us to come to the home and be experiencing a home visit, but it was interesting, about half and half. Half the parents wanted us to come to their home and half said, no, we don't want you here. We prefer to come to the clinic. And so finding out what parents prefer and families prefer is really helpful. Materials available in the home can be used on a virtual home visit, so we can see the child interacting and being part of their natural environment. Adequate time needed for the home visit is another consideration. And then language. So the virtual home visit can be conducted in the family's preferred language. The last strategy I want to talk about is developmental screening via snail mail. So this is where we would mail the developmental screening home to the parents. They would complete it and mail it back to us, and we would score it and give the family feedback, and it would be done through snail mail. If you're going to use this strategy, be sure to have the family's correct mailing address. And what we've noticed is that return rates for questionnaires can be increased with a variety of strategies like reminders home and calls to parents. And if they need it, sometimes parents get busy and they lose it, or they need an additional questionnaire because they've maybe misplaced the other one, or they need a different one, and responding to the parents' needs is really helpful. So some things to do when you're using one or more of those strategies: become familiar with the virtual and remote child find strategy. Whichever one you pick, maybe you're doing all four of them. I know for me, I used Zoom before the pandemic happened, but now I really know Zoom. I've learned a lot of different things about video conferencing that I had no idea about 2 months ago. So whichever of those virtual remote strategies you use, you'll become comfortable with it and learn about all the different ways you could use it. Consider what you already know about the child. Maybe it's a child you've already been serving, and so you already have some background information about the child. And this could be a way to gather additional information using a variety of virtual methods. Or maybe it's the first time and it's an initial screening and you don't know the child, and maybe one of those strategies can help you learn the child and family needs and get to know them better. And then design virtual activities for observation and assessment and a plan for moving forward. I just talked about 4 different strategies for doing virtual remote child find. Now I want to talk a little bit about communicating with parents. The most important part of all of this is communication and being able to provide feedback to families. And it is all built on a foundation of trust. And so trust takes time, and we need to invest the time to be able to establish rapport with families. And being a trusting member of the family's community is going to be helpful. So we want to reflect on our communication with our families and provide effective communication strategies and skills when we're building positive relationships with young families or with young children and their families. Face-to-face communication is one way to interact with families of young children. However, alternatives to face-to-face communication are just as important. So an alternative to face-to-face would be text messaging. A lot of families prefer text messaging, leaving voicemail messages, calling them on the phone and being able to have a conversation with families, video conferencing, but finding the way that works best for the family and parents and the provider is going to be really important. The way we communicate and interact with one another have changed with recent events due to the global pandemic. I don't know about you, but I have never talked this much on the phone since I was a teenager. When I was a teenager, I had the phone like permanently glued to my ear. I was always calling my friends on the phone, and I kind of reverted back to my teen years, and I'm on the phone all the time now. So that's, I guess, a good thing that's happened. Communication has changed. Electronic communication could be email, text messaging, online, or virtual conferencing. So these are some publications and resources that might be helpful to you. I said earlier that I wasn't going to talk about a specific screening tool, but in this first resource that I have listed here for you is an article that I wrote for infants and young children, where I studied several different screening tools, and I examined the evidence behind all of those different screening tools. So if you want to learn more about that, it's available in that article. The second one there from 2013 is ideas for providing developmental screening in a social service context. It was published in Child Welfare 360, and so that's another helpful article if you're doing work in the social service arena. The third one there I'll talk about in just a little bit. It's a book that I want to refer you to. The Macy Marks Towel is an article about policy implications for child find. So it talks about the ways that we miss kids and how we need to improve our early detection systems to optimize child outcomes. The 2017 article is about a management system for doing child find. So ways to have it be more streamlined and less fragmented. The second to the last one there is an article that I wrote with some colleagues about screening in an early childhood context. And it has a lot of practical ideas and vignettes to be able to use in early childhood settings. And then the last one is about electronic communication that I wrote with 2 of my students. So the book that I got a lot of this information from is called Developmental Screening in Your Community. I co-wrote this with Diane Bricker and Jane Squires, who a lot of you know from their work in the Ages and Stages questionnaires. Diane and Jane are the developers of the Ages and Stages questionnaires that are published by Paul Brooks Publishing. And then Kevin Marks, the other co-author, he's a world-class pediatrician. He used to practice in Oregon and now is in Denmark. And so Drs. Bricker, Squires, Marks, and I put together this resource for how to do child find and to determine if children need IDEA services and how to link them up with the services in the community. So to recap, I've talked about child find and how it's a component of our law, IDEA, how we can be able to improve health, education, and social outcomes for children when we do effective child find. And I talked about 4 different ways we could do remote and virtual child find activities, and then communicating with parents when face-to-face is difficult or not available. So now I'll pass it over to Dan, who is going to be talking about a giveaway of the book.
Excellent. Thank you so much, Marissa. That was a fantastic presentation. So for 3 of our listeners, we will be giving away a copy of the Developmental Screening in Your Community book that Marissa was just talking about. So we'll select 3 viewers from today's presentation, and we'll email you after the presentation and send you a copy of this book. And we are also providing a discount code on Brooks's website. You can save 20% at checkout using the code Coffee Talk. So you'll just enter that code into your checkout cart when you're completing your order, and you can get 20% off of most of our Brooks products. And if you're interested in more professional development resources, we have plenty of prior coffee chats as well as upcoming coffee chats as well. Marissa, if you could just jump to the next slide. So you can go to this bit.ly here, Brooks Coffee Chats. And we have all of our coffee chats are recorded, so you can look through past presentations, and you can also register for upcoming presentations as well. And we also have additional COVID-19 resources, including recommended reading, downloadable resources, and other professional development webinars that you can access here at this bit.ly as well. And we'll include links to these in our follow-up email too. And so now I'll open it up for questions. So if any of our listeners have questions, you can go ahead and enter those into the questions tab in your webinar panel, and we'll get those answered. So I'll just start with a few that have been submitted during the presentation. So Marissa, one of our listeners asked, what does it mean, what does actively locate mean at the preschool level?
Oh, that's a great question. Thank you, whoever asked that. So actively locating. So child find is something that is a legal requirement as part of the Individuals with Disabilities Education Act, and it's for children birth all the way up to age 21. And in school age settings, it's much easier to locate the children who are eligible because students are in traditional settings, in classrooms. But for early childhood, infants, toddlers, and preschoolers, they're not all in the same setting. They're not in a classroom or a traditional environment. Some children might be at home, and some might be in universal preschool. Some might be 2 days a week in a toddler program. So there isn't really a place where all babies go or all preschoolers go. So being able to locate the children who are eligible and who need IDEA services is much more of a challenge in the early childhood years. So actively locating preschoolers would be to do those 4 parts of the child find system, what the law requires, having a central directory, being able to disseminate widely information about the program, being able to have accessible services and child find activities where children and their families could go and get screened. So those are some things that we need to do in the early years when it's so crucial. And development is happening so quickly, and children are changing every day. And so being able to being able to have a good child find system is so important. Thank you.
Great, thanks, Marisa. Another listener was asking, what sort of precautions should a program take when they're using a screening tool virtually? I guess, are there sort of legal issues that they may need to take into account? I guess using a digital platform or something along those lines.
Well, I would say check with your agency and the program that you're working with, because there are considerations to be made for maintaining privacy and confidentiality. So those would be things to check within the agency.
Okay, great. And another listener asked, can you talk a little bit more about how follow-up is lacking in the healthcare setting?
Healthcare, okay. I'll talk a little bit generally, and then I'll talk about healthcare. There's drastic drops in referrals now that we are no longer face-to-face. It was a problem before, but now it's even more of a problem. We are home now, we're quarantined, and parents and children still continue to need child find services. But it's much harder now to do it now that we're no longer face-to-face. And so in health, education, and social contexts, we need to continue to find ways to be able to have the show go on with child find. And so what is happening is children may not be referred for screening, or they may not be referred on for comprehensive evaluation, or maybe the problem is they are determined eligible, but getting the services that they need is either delayed or it's not happening. And so being able to have a referral system that we can count on, that is dependable, is going to continue to be important as we have maybe not as much opportunity to see children face to face and their families, both in a healthcare setting as well as in an educational setting. So I know for my own family, we have a pediatrician that we go see on a regular basis, and access to the doctor's office is limited right now because of the global pandemic. And so pediatricians may only be seeing children when they are severely ill, and they may be seeing children less and less when it's a wellness checkup or part of their regular routine visits. So all of us working together in health, social, and educational settings will continue to be of paramount importance when we are conducting a child find system in our states.
Great, thank you, Marisa. Another listener asked, the 2 to 3% of the population for early childhood that you were referring, early childhood intervention that you were referring to earlier. Oh, I just lost the question. There it is. Is that statistic for children that are served? And if so, how does that compare to the actual percentage of the population with disabilities?
Well, that's a really great question. Thank you for asking that one. So that's the children who are being served. That's the child count data that we have that's reported to the federal government. And so it's believed that that number is much larger than it actually is, because those are just the children who are receiving Part C services. Something that's different from the school age part of IDEA is for Part C, infants and toddlers, states can serve children with delays in addition to children with identified disabilities, and states can also decide to serve children at risk. So an at-risk condition could be environmental risk, biological risk, but states are able to serve the risk population if they choose to. Unfortunately, there's not a lot of states that do serve children at risk, but that's different than Part B of IDEA. Once we get into Part B, it's only children with disabilities that have an identified disability that is served under IDEA. So that's one of the differences between Part C and Part B. We can also, under Part C for infants and toddlers, be able to use the label developmental delay instead of putting another word on, or category on top of it in order to get services. So the developmental delay category can be used in states. So that's another thing that's different from Part C compared to Part B.
Great. Thank you, Marisa. We also have a listener that was wondering if you can provide a place where they can get more information or an example of a quality state central directory.
Oh, that's a great question. Help Me Grow is a nationwide program. It's not in every single state, but it is in a lot of states. I think the last time I checked, it was 28 states that have Help Me Grow. That's a resource that you can check out that does child find. So that's a follow-up. Also, I have my email address here that you can contact me if I can be of any help or assistance to you. MarisaMacy@gmail.com is my email account. And I would love to be able to give you any resources and help if you need more ideas for child find or just some support.
Great, and we'll just take one last question and then we'll wrap things up. So we have a listener that was saying that rural areas are having difficulty finding services once the children are identified and qualify for services in both early intervention and early childhood. So do you have any suggestions for recruiting services such as speech or physical therapy?
Yes, that is so true. And that was even before the pandemic happened. Yes, so rural settings, it's much more difficult in rural areas to be able to serve the children who are eligible for IDEA services. I would say the first place to start is with your lead agency. So here in my state, it's the Department of Health. And so going to the Department of Health and working through the lead agency to identify what resources we have and how to continue to build on those would be the starting point. And then maybe reaching out to other communities that are similar within the state and maybe outside of the state too, that maybe is a similar type of community as yours if you're in a rural area, and finding out what they're doing. But definitely finding services for children is much more of a challenge in some areas. I used to live in a state where our early interventionists would drive 2 hours to go see a family. And so it wasn't like they could go every day out there to be able to serve the family. So working together within the community to find out ways to support the child. There's also other strategies for to serve children that uses different modalities, and maybe the professional is not able to be there as frequently as the family or they would like, but being able to give the family ways to continue with the interventions even when the professional is not able to make the home visits face-to-face or be there in person. So for example, one family that I worked with, their child was receiving speech language therapy from a specialist. And when the specialist was on the home visit, they would give the family different things to do during the week before she came back the following week. So one example was they were working on the child's oral motor skills. And so the child was they had a pinwheel, and they would practice blowing in the pinwheel to get the muscles around their lips stronger. And so that's something that the parents can do every day and play with their child and have fun and be able to incorporate it into routines. But it's something that the provider is able to leave and the family can do even when they're not there, so that the parents can be able to support the child's development in the areas that they need support in.
Okay, great. Thank you, Marisa. So if there's any questions that we didn't get to today, we'll follow up with you after the webinar. But I'd just like to thank Marisa again for this presentation, and thank you everyone for attending as well.
Well, and I want to thank you, Dan, too, for putting this together, and especially to Brooks Publishing for offering these coffee chats. And I just want to say Happy Mother's Day to all of you out there that celebrate Mother's Day. I want to thank my own mom and wish her, Elisabetta Galliano, a happy Mother's Day, and my mother-in-law, Marcia Macy, and my grandma, Dorothy Galliano. And for all of you out there that celebrate, I wish you all the best. And thank you for joining me today on this webinar. I've enjoyed it. I was a little nervous when Dan told me there's over 420 people that are going to be on here. So I hope I was able to give you the information that can make a difference for you, the families you serve, and the amazing children that we get the privilege to be a part of their lives.
All right. Thank you, everyone. Have a good
Thank
weekend.
you. Bye.